In this chapter, we'll consider 3 eating disorders: anorexia, bulimia, and binge eating disorder. There are a few more eating disorders which are far less common and not discussed by your text, so we'll focus on these 3. We should note that they are a family of related disorders. We're briefly going to consider treatments and then dive into the individual disorders. For anorexia, it may require nutritional rehabilitation if the extent of the weight loss is a severe threat to health, which it sometimes can be. It should occur with psychological therapy, in other words, psychotherapy. CBT is usually the preferred therapy, and family therapy, although optional, is often very, very helpful and is frequently undertaken as well. Now, you should note that of the 3, anorexia and binge eating disorder, neither use antidepressants commonly. Bulimia would be the only one that would. For bulimia, psychotherapy is, of course, critical. Again, CBT, cognitive behavioral therapy, is preferred. And for this one eating disorder, antidepressants are often very, very useful. For the last disorder we'll consider, binge eating disorder, of course, psychotherapy is essential. Again, CBT, one of the forms, is preferred. And as noted, antidepressants really usually not required. Now, if the second type, binge eating and purging, surprises you and you're saying to yourself, that's bulimia, isn't it? No, a bulimic will typically maintain normal or even a little bit of heavy weight, versus the anorexic is using tools to restrict his or her or their weight down to a healthy level given their frame. Let's look at the typical characteristics. Essential is the person refuses to maintain a normal minimal body weight, again, by either restricting or binge eating and purging. They are very fearful of weight gain. It might be their greatest fear in life. They will either have a very distorted body image, seeing themselves to be grossly overweight, or maybe healthy and attractive when people see them as skeletal, or doesn't understand the implications of their behavior in terms of body damage or even potential fatality. Let's start our discussion of the eating disorders with anorexia, though it can be referred to in a more formal manner, hence the blanks on the second word. Take a moment and see if you know the secondary term. If you're thinking nervosa, indeed you're correct. Now, if you're watching or viewing these slides on your own, please go to the 2 links. Now, you need to know that there are 2 varieties of anorexia nervosa. The restricting variety, which means the person is maintaining their unhealthy body weight by severely restricting their calories, versus the secondary type, binge eating and purging, which means the person, after eating a normal amount of calories or even a very supranormal amount of calories, will then eliminate those calories through the unhealthy means of purging. The individual with anorexia uses unhealthy means to maintain their abnormally low body weight. Take a moment and think if you can think of these common means, and they're often able to hide, at least in the initial stages of the condition, from others. Try to think of how they might do so. So tackle the last 2 bullet points and see what you come up with before listening to the answer. So let's consider these unhealthy means. Well, obviously, severe restriction of calories could easily be less than 500 calories a day. If the person is the binge eating and purging type of anorexic, purging would obviously include vomiting, but not necessarily. Could also use laxatives and or diuretics. Or excessive exercise are amongst the favorite means. How do they hide it? Well, if you eat with them, they might push the food around the place, then have to run to an appointment, and if you weren't watching them carefully, you might not realize how little they ate. Often we'll take the food to go. At home, they might open a can and leave it on the countertop. Put dishes in the drying rack. What do they do with the food? Down the toilet, down the trash compactor, or the dog might start to get strangely heavy over time because the dog's getting all the person's food. Baggy clothes are often used. So there's many tools to hide this condition, at least in the early stages where the person is not showing extreme gauntness, such as in the picture on this particular page. Let's now consider contributors and related information. Culture plays a role. It does not occur in cultures in which a significant part of the population is severely underweight. If there's malnutrition, the person would not want to look starving, look poor. So again, it's only present in affluent cultures. Body dissatisfaction is very typical even before the behavior begins. Individuals typically have a type A personality, controlling, perfectionistic, high standards. Often family over-involvement, not enough space. They're too much into these other issues, and it's not uncommon for have mom play a role in this in terms of trying to keep her daughter thin and constantly an issue when the child was much younger. Members of the LGBTQ plus population have higher risk. Most, but not all people with it are female identified, 75%. Comorbidity, in other words, conditions that commonly co-occur with it, would be the anxiety disorders and depressive disorders. Our last point in terms of suicide risk, take a guess. 2 times, 3 times, 5 times? You might be surprised to know that it is 18 times the general population. In terms of how many individuals actually attempt it, is it 10%, 20, 30? Actually, 25% of people with an anorexia nervosa diagnosis do attempt suicide. Again, showing you the essentialness of therapy. Let's now consider bulimia, or more formally termed, as I suspect you know, bulimia nervosa. If you're viewing the slides on your own, please now go to the link. For diagnosis, the binge would have to occur at least once a week for 3 months. Now, if you note that this does not match your text, the slide reflects the newest DSM criteria, which has been slightly reduced. Essential to it is unhealthy compensatory behaviors after the binge to prevent the person from gaining weight or even becoming obese. Essential to the diagnosis is that the person feels lack of control during the binge. It often co-occurs with other disorders, such as the anxiety disorders. Can you think of our proper term for when disorders co-occur with another one? I'll give you a moment. If you're thinking comorbidity, exactly. Suicidality, about 25 to up to 33%. In other words, a third of people diagnosed with bulimia nervosa will make a suicide attempt. So again, treatment would be essential for his or her or their health. Next, please consider binge eating disorder. And again, if you're viewing these slides on your own, please go to the 2 links. Now, during the binge, such as with bulimia, there's a feeling of lack of control. And as with bulimia, when a binge is occurring, it's done alone. It's a secretive thing. Afterwards, there are various negative feelings. It might be guilt or disgust or anxiety or sadness, but virtually always accompanied by negative feelings. For it to occur, for diagnosis, it has to occur a certain number of times a month for so many months. See if you can guess it. If you say, oh, I don't know, I'll guess the same as for the previous disorder. I'll guess at least once per month for at least 3 months. You're correct. Comorbidity It often co-occurs with depressive disorder. If you, and again, please try to ignore the clacking of my rescue doggy around the house. His name is Bailey, by the way, if you haven't met him in social psychology. Next, on your own, please consider the damage caused by the eating disorders to the person physically. Jot down as many as you can and see how many match the next slide, but no cheating. This slide lists just some of the potential physical damage that can occur from eating disorders. Tooth damage if vomiting is engaged in. Look at the image of the person's mouth. That must be amazingly painful, all those bare roots exposed, and even the palate has acid holes in it. Esophagus damage as the acid comes up the throat. And again, that's a risk for cancer. Broken blood vessels in the eyes if vomiting is used. Spontaneous vomiting when the person's not trying to, such as in a public situation, a classroom. So the person feels embarrassed, they try to swallow it, which means they could choke to death or get pneumonia. Osteoporosis if the diet is severely restricted and not sufficient calcium intake. Muscle loss, nutritional related diseases, kidney disease, liver disease, and since the heart is a muscle, it can be heart damage, or especially if the electrolytes are not in the correct balance, heart failure. And again, this is a short list, reiterating and supporting the idea that eating disorders need to be addressed not only for the person's quality of life, but for the physical health and even survival.